We are doing my second total ear canal ablation in 24 hours. This is a dog, you can even see in that ear canal, this is just one of the worst ears I've seen in a long time. So we've done a CT scan to confirm that there's no evidence of neoplasia, and now we're doing just a routine total ear canal ablation and lateral bulla osteotomy. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. Hope everybody's doing well. I know I'm streaming less frequently now, but I'm only working 2 days per week at Southpaws. I'm doing about 2 days per month in Adelaide, and I'm trying to figure out how I can live stream on the road. So I just have to make sure I have all the right equipment and that we have enough broadband, as in enough bandwidth at the hospitals where I am streaming, because we have really, really good internet here. And that is not the case everywhere else I work. So, with total ear canal ablation, can I get cautery turned down to 20 and 20, please? I make this vertical incision over the vertical ear canal, and then I come up and make my circumferential incision around the external ear canal. Might be a little bit light, Camille. And Piyush says hi. I think Piyush is coming to visit us in a few months. I think late June, early July. It's really fun, the relationships that I've made with people through the YouTube channel, and people that have come to visit us, and also people that I run into at conferences. Can you ask Ray for a little hook cautery if it's not going to compromise your...
What did you ask? A hook cautery.
So this part of the procedure, there's not a lot that I'm too worried about. When I get around the opening of the ear canal, I start being concerned about the cranial, middle, and caudal auricular arteries, which supply the pinna. If you damage those, you can potentially get pinna necrosis. I've only ever had that happen once, and that was in a diabetic cat, so I'm sure that it had some vascular disease, like humans that have diabetes.
Did you want a shorter one, Charles?
Yes, please, the short.
Needle one.
And I'm trying to excise the majority of the diseased skin.
Did you want that on yet, Charles?
Yeah, we'll go ahead and switch that over. So I have this special little needle hook probe that I love. I use it for a lot of different things. Number one, it's just a really delicate cautery tip, and the other thing that you can do is you can hook it underneath tissue and just lift it up. And you can use the back side as regular cautery as well. And I made this one myself from just a needle cautery tip. And I really take my time on the dissection here. I'm just trying to stay right on that auricular cartilage. Because that's the way to avoid damaging the facial nerve. So those of you who have seen me do TICAs before would know what the potential complications are, but if you guys want to review them in the chat for me, I'll see if you guys can remember them. So there are four or five complications that you can get with total ear canal ablations. And if you don't come up with all of them, then Ewan's going to have to. And I'm not sure if he's going to be very happy with me, but I think he'll be fine, since he's heard the spiel many times before, both scrubbed in with me as well as probably in the consult room, as well as probably having done the VetDojo module. Have you done that?
Mm-hmm.
So what are the complications that we see with total ear canal ablations?
Are you talking to me or them?
Nope. Alright, so now we switch over, get some towel clamps, and use them to retract. Just retract on that against the switch back over to my other cautery tip. Does anybody come up with any of the potential complications with total ear canal ablations?
Not yet.
What's the most common one that we see? All right, so facial nerve palsy, that's the most common one that we see. That's good. Piyush came up with that one. So what else can we see with total ear canal ablations? Come on this side. All right, Ewan, come up with another one.
Horner's.
Horner syndrome, okay. Is that more common in cats or dogs?
Cats.
So Horner syndrome is more common in cats because the sympathetic trunk runs right through the middle of the bulla, and it's actually on the septum. So what other?
Intra-op bleeding.
Okay, intra-op bleeding, very good.
And
So-
how common is wound dehiscence?
Wound dehiscence is uncommon but not rare. So it certainly can occur. Intra-op bleeding, there are a bunch of big vessels in the area. The most common one that you get is the retroauricular vein, which I got yesterday. You have also internal branch of the internal carotid artery, which is medial to the bulla. I think you've got maxillary vein that's close by as well. So hemorrhage certainly can occur. It's rarely life-threatening, but I have seen somebody else have a patient die during a total ear canal ablation. And the issue usually with bleeding that the patient dies from during that procedure, it's because of spending too much time trying to stop the bleeding rather than just packing it off.
If you don't remove the bulla properly, potential draining tracts.
Yep, so that's great. So not removing the entire lining of the bulla, you can have draining tract formation or fistulous tract, or sometimes you just get an abscess.
And Chris and Ralph have said vestibular.
And vestibular signs, that's really good. So if you go too far dorsal in the bulla, you can damage the vestibular apparatus if you go up into the vestibular recess with your instruments. Regarding abscess formation, recurrent draining tracts, what type of dog is that going to be most common in? Can you retract that for me? So the kind of dog that's most likely to get recurrent draining tracts is brachycephalics, because they have a really weird bulla that's actually medial to the where you would expect it to be in other dogs. And so you often, the issue is that you think you've done the surgery completely, but you've actually left the whole bulla intact. If you leave the bulla intact, you can't possibly have removed enough of the lining of the bulla.
And when that mistake's made, Charles, where are people under the impression that they've made the osteotomy? Or where have they made the osteotomy?
Often they have so much thickening of the ear canal and calcification of the ear canal that they've just...
Breached into that.
Yeah. So I would typically, where I don't feel like I have to CT most dogs before total ear canal ablation, definitely with brachycephalics, I'd want to CT them so that I know what that bulla looks like and where it is relative to the external ear canal. Look on that for me, please. So I've still got a lot of tissue there. And the key, again, with preventing facial nerve palsy is making sure that we remove all, or that we go right down onto the auricular cartilage when we're dissecting out. I'll put the cautery away in a minute. I'll just go with sharp dissection. I have to be really careful with this Gelpy, particularly this ventral one, to make sure I'm not picking off the facial nerve. And I may be able to show you the facial nerve, and hopefully not in cross-section. And that's a little branch of the facial nerve right there. I know that you'll be able to see that from the angle of the camera. Dog's getting light, Camille. So this dog has a heart murmur. And so we're trying to be really careful with the level of the anesthetics and the amount of fluid that we're giving. And if this were my dog, I would not want any other nurse than Camille.
Fairly painful procedure, isn't it?
Yeah, it's pretty sore. So I'm probably going to have to sacrifice that branch of the facial nerve.
It's like it's punching straight into the...
Yeah, we're going right into that cartilage. Camille, can I get cautery turned down, please, to about 10? Hello from Connecticut. Hello from Maryland. Overnight ER entertainment. Glad I can help. Make sure that that's not the whole facial nerve. I don't think it is. I think that's the facial nerve down there. There's just so much reaction from the severity of this dog's otitis. It's hard to be confident that I've gotten through all of the reactive tissue. Here we go.
It's a nice blend.
Yeah. We can start on my next one, please.
Just once you would look at the scan.
I would need to get Luke in here for me to do that. I think that's facial, right?
I think that's facial nerve right there, yeah. So I'm just trying to palpate the ventral bulla. I think that's the opening to the bulla
Mine
right
has a
there.
heel, Charles.
Not at all.
Yep.
And so I can feel the ventral bulla right there.
It's not as bulbous ventrally as
Some
feel
of
like
them are,
sometimes
yeah.
we feel.
So I'm looking at the ventral bulla right there. So that tells me that I can be confident that I've at least gone far enough down the,
And that's where retroauricular hangs out, isn't it?
right
The
up here.
cranial with that.
Yeah. Okay, so I've cut through the ear canal there. Okay, so that's ear canal cut off right at the opening to the bulla. Now I'll take my rongeur. Can I get a smaller Ruskin, please? So that's through the...
Smaller.
It might be okay. So now I'm just chipping away ventrally. I can see the inside of the bulla now very clearly. And using this kerosene is nice because I can be quite accurate with where I'm removing bone. And I'm trying to avoid that rostral kind of 3 o'clock position.
From a vascular perspective.
Yeah.
Get in here, Luke. I'm going to go on this.
And which scan are you looking at?
My spine is in easy.
Right. I've got rotating assistance. So Ewan's gone. He has to go and look at a CT. And Luke is in. So I'm just chipping away that ventral bulla. And I've opened that right up. So I've removed about the ventral 30% of the bulla. And now I'm going to scrape out the inside of the bulla. I don't know if you guys can see. You probably can't see that very well, but I'm actually looking at the inside of the bulla here. And I wear loops for this procedure. I wear loops for most of my procedures because I'm old and blind. And I'm staying away from that dorsal vestibular recess. Nice big piece of lining there. Hold on just a second. So that's all lining there that I've removed. And now the bull is completely clean. Just having another look. That's an auditory ossicle. I can see up there dorsally. And that's the remainder of the facial nerve right there, just that white patch. So we'll go ahead and lavage this out. Can I get some mepivacaine, please? I'll just do what's called a splash block here. Maybe inject a little bit of mepivacaine. Take some 3O PDS, please. I'm avoiding that facial nerve during my closure. Anybody want to hazard a guess as to where the facial nerve comes out of the skull? What the name of the foramen is? Again, I'll repeat the question. Anybody want to hazard a guess as to where the facial nerve exits the skull, through which foramen? Thalamastoid, that's right. Bridget. Very impressed. You get a cookie. Buy yourself a cookie and send me the bill. Have you closed these before?
No.
Okay.
It's like a T.
Yep. Give me a little bit of slack over here, thank you. What's that? Another hard question. Camille is saying I need to ask another hard question. So you guys can thank her. What's the difference between the canine and feline tympanic bulla? What is the difference between the canine and the feline tympanic bulla? The feline tympanic bulla has what? Give me a little bit of retraction there. I know that there's a delay. 2 compartments. Bridget, superstar. You can have another cookie. Okay, next question. True or false? Humans have a 2-chamber tympanic bulla. True or false? Humans have a 2-chambered tympanic bulla. I'll repeat the question. True or false? Humans have a 2-chambered tympanic bulla. And it is a trick question. And the reason why it's a trick question is that humans have no tympanic bulla. So not only do they not have a 2-chambered one, they don't have a 1-chambered one. All right, do you want to put in an intradermal there?
Mm-hmm.
And then just do
Skins.
skins there, yeah, with
Yeah.
the, yeah. Okay, so Luke's going to take over and close for me. I'll come back and make sure that I haven't missed any questions.
Yeah, that's some 3.0. That's the one that's 75. Isn't it?
So we've got a couple of responses of pugs, brachycephalic breeds, that's really good.
Yes.
Is there enough left?
So that is excellent. Great responses to all of my questions. I'm very pleased. So I'm going to go ahead and wrap that up. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. And I'll see if I can stream something else today. I just have to, it depends on what theater I get put into.